Hello, hello, hello. Welcome, welcome, welcome. How's everybody doing? It is Dr. Melva, and we are broadcasting live today on Thursday, October 12th, 2017 at 6:30 p.m. Eastern. I'm coming to you live from North Carolina. Welcome, welcome, welcome. Everyone, come on and join me today. If you're watching the replay, thank you so much for joining. I'm Dr. Melva. We'll get started in just a few minutes. I'm your Board Certified Radiation Oncologist. All right, today we are talking about Breast Cancer Awareness Month. This is the first in a couple series that we'll be doing this month for the month of October. Welcome, welcome, welcome. Come on in. We'll be getting started in just a few minutes. All right, come on in. I need some music to get us going. How's everybody doing out there? All right, I hope my volume is good and you can hear me. All right, so thank you so much for those of you just joining me. I'm Dr. Melva. Welcome, welcome, welcome to the broadcast. I'm Dr. Melva, your board certified radiation oncologist, and I help patients that have been diagnosed with cancer through my videos, speaking, and second opinion consults via telemedicine. I help you to understand your diagnosis, navigate the cancer care system, and live a normal life in spite of cancer. You can find me right here on facebook.com/Dr. DoctorMelva. And if you send me a message through Messenger, you can learn more. I'll send you my link about my telemedicine second opinion consults. So if you need a friendly, caring doctor to help you understand your diagnosis and understand your cancer treatments, then you got one right here. All right, let's get started. Thank you so much for joining today. I'm Dr. Melva, and let's talk about Breast Cancer Awareness Month. So we've gotten the message out. A lot of people understand that October is Breast Cancer Awareness Month, but are we doing enough, and are we understanding and asking the questions that we need to ask? So when I was preparing for today's talk, I talked to a lot of my patients that I've treated and asked them some of the questions of what they wanted to know, what would be helpful in discussing breast cancer awareness. You'll see lots of great posts from lots of doctors, other organizations for the month of October. And I think the most common question that I get, welcome to the broadcast, welcome to the live broadcast. I think the most common question that I get about breast cancer is, how do I prevent it? Actually, the most common question that I get at all is, how do I prevent getting any cancer? So I wanted to spend a few minutes talking about prevention in breast cancer, and that's what we're going to do today. This is going to be a little bit shorter of a broadcast. Okay, so one of the first things that I want to say about breast cancer is that 80 to 85%, welcome to the broadcast, 80 to 85% of all breast cancers are non-hereditary, meaning that, okay, just making sure I can see, meaning that there's no family history of breast cancer in 80 to 85% of women that are diagnosed with cancer. So that means that many of the women who have cancer had no one else that they know in their family that ever had breast cancer before. And so that's really important. And the reason that's important is that a lot of what we know about breast cancer, a lot of the reasons we're getting it is based on what we're doing, and that includes food that we're putting in our mouths, the environment, toxic loads, how much we move our body, exposure to different chemicals. Welcome to the broadcast, welcome to the broadcast. So a lot of breast cancers can be prevented because they're not hereditary. Okay, so that's kind of the first thing. So that leaves about 5 to 10% of breast cancers that are hereditary. There's a genetic basis, whether that's a mutation. So some of the ones that you hear more often are BRCA, BRCA1, BRCA2. We're learning about P53, P10, which is PTEN. So can't go into all of what that means in the context of this Facebook Live, but I just want you to know that those are some of the genetic disorders that are most commonly known to be connected to breast cancer. And there are many more that we're learning about. Okay, so fact number one that I want to make sure you understand is that 80 to 85% of women that are diagnosed with breast cancer they're the first ones in their family, okay? So it's non-hereditary. So that means that there are things that we can do to prevent it, because that means that it's what we're doing to our bodies, our environments, that affect breast cancer, okay? So then that's what I want you to know. Risk, what we can do, genetic disorders. The next is screening. Screening is a way to detect breast cancers earlier. So I was listening to an analogy of another doctor speaking, and I think it made a lot of sense. So I'll share it. Shout out to Dr. Funk, plastic surgeon, well, actually breast oncologic surgeon. And she described the ladies, I like to call them the ladies, boobs, tatas, whatever you like to call them. Welcome to the broadcast. Thanks for joining. We're talking about Breast Cancer Awareness Month. This is Dr. Melva, your board certified radiation oncologist. And I was listening to a surgical oncologist speak, and she, described the girls, tatas, boobs, ladies, whatever you like to call them, that when you're having a mammogram and they're being smushed, before we did 2D mammograms, so the ladies were smushed, and it was like a loaf of raisin bread, and you're smushing the whole loaf of bread, and you're saying, hey, find the raisins. Now with 3D mammographic imaging, it's like taking that same loaf of raisin bread, slicing it into 15 to 20 slices. Then, sorry ladies, we're still squishing the ladies together, then saying find a raisin, and it's a little bit easier to find that breast cancer because we can see it much clearer. So it's important when we talk about breast cancer and breast cancer awareness that we understand the options of detection and early detection, okay? The age has been controversial. You'll see a lot of different reports. I still support that women at the age of 40 years old should start to have mammograms. You need to have them earlier if you have a family history of breast cancer, a known family history, usually 5 years earlier than the diagnosis of your family member. Okay, so those are a couple things. So just to recap really quickly here, and I can't see the comments, so I may have to catch it afterwards. I'm not really sure why Facebook Live is not working. So, all right, so one, the majority of breast cancers are not hereditary, which means that if no one in your family has ever had breast cancer, I don't want you to think that you're immune, meaning that you won't get breast cancer. It's possible. So understand what you need to know about breast cancer. Okay, sorry. Understand and learn about breast cancer, the risk, signs, and symptoms, and we'll cover that in the next section, so you have to stay tuned until next week. So number one, 80 to 85% of cancers are not hereditary. So if you're diagnosed with cancer, you may be the first woman in your family. Number two, because we know the majority of breast cancers are not hereditary. Now 5 to 10% are linked to genetic causes, so we kind of mentioned some of those. So BRCA1, BRCA2, P53, P10, and in another series I'll kind of explain those. But those are hereditary risks known to be linked to breast cancer. Okay, and then number three that I went over is that since we know that the majority of breast cancers are not hereditary, it's what we're doing to our bodies, okay? And we can prevent that. So it's the food we're putting in our mouths, the first time to pregnancy, how long our body's exposed to estrogen, our weight, how we're moving our bodies, and we can get into that a little bit more too. So drop in the comments and let me know in the next series this month, which of these questions or topics do you really want me just to go in on, okay? And I'll do some more teaching because there's so much that I would love to teach about this topic in this month. So let me know what you want to hear, okay? And I'll put it together for the next series. Okay, and then next, we talked about early detection, okay? Early detection saves lives. Our number one threat or number one cure against cancer is to stop ourselves from getting it, so prevention. And the next one I would say that's important is to find it early, okay? So early stage, we can do a lot more for cancer treatment than in late stage, okay? Thank you so much for joining the live broadcast. I have to figure out why my, thanks so much for joining, Lisa. Okay, I can see your comments. I was in the wrong window. Thank you so much for joining. Okay, so are these tips helpful? Can everybody hear me? I hope this is helpful to you. It's Dr. Melva, if you're just joining or catching the replay. We're talking about breast cancer awareness. It's October, broadcasting live from North Carolina today. Okay, so we talked about hereditary signs, non-hereditary breast cancer. We talked about, hey Dawn, welcome, thanks for joining the broadcast today. We talked about hereditary breast cancer and non-hereditary. Most breast cancers are non-hereditary. We talked about other genetic factors. We talked about early detection and screening. So I talked about 3D mammograms. Gave the example that if you're looking at a loaf of bread with raisins in it, we used to squeeze it and say, help me find the raisins. Now we can slice that bread into 15 slices, then squeeze it. And the bread in this analogy are the ladies, the girls, okay? Like showing you my boobs, sorry. It's always funny talking about this. So, and we can see it better now, okay? So we went from 2D mammogram to 3D mammogram. So we're seeing clear, which means we can find the breast cancer earlier, which means we can treat it before it spreads, and we can cure a lot of disease, okay? A lot of breast cancer. All right, so I hope this is helpful. This was a quick introduction. Those are the things I wanted you to know. I'd really like to talk about nutrition and what we can do to prevent cancer, because that is, thanks Dawn, and shout out to that. I kind of said earlier, I watched a breast oncologist, Dr. Funk, so shout out to her for that raisin bread analogy. I think it just really, really does a good job of talking about the girls and the ladies and finding breast cancer and how we can find it earlier. So thank you for that. All right, so let me look at the comments, kind of looking at the comments. So Lisa says, hi, Doc Melva. Hey, Lisa, how you doing? Thanks so much for joining. And Dawn says, hi, great analogy. Thanks so much for that. All right, I hope you got a little bit in this introduction. Like I said, this is Dr. Melva. If you're just joining or watching the replay, it's Breast Cancer Awareness Month in October 2017. Please let me know which topics you want me to talk about. Comment below, and I will do a detailed Facebook Live next week. But for today, I want you to know that we can prevent breast cancer. We're going to talk about nutrition, what we can do, screening, early detection, exercise, the links to overweight and obesity with breast cancer that we know. We can get into that, but let me know what you want to hear, okay? All right, so let me read okay, so Lisa says, I just got my mammogram done last week. All right. And they called me back saying they need to do it again. I'm a little nervous, but they told me not to be. Okay, Lisa, so one, congratulations for getting your mammogram. I think that's the great first step. Don't be nervous. Sometimes we have to call you back. The radiologist looks at a film and they may want to look at something closer. So they may need to do an ultrasound where they actually press against the breast tissue. And an ultrasound is showing them, usually for cancers, you look if it's, you're looking at the width and the height, and you see more specifically kind of a difference that they're looking for to see if it's a cyst, which could be benign, and we hope that's what it is, a fibroadenoma, dense breast tissue where it's harder to tell normal breast tissue. Okay, sorry about that. I'm not sure where it cut off. I forgot to cut my phone off. So I was saying that, Lisa, hope you're still there, was saying that an ultrasound can tell us or help us. Okay, sorry about that. Sorry about that. I may have to wrap up. My phone keeps cutting off. So anyway, I was just saying, to recap, that an ultrasound can also tell us, hold on one second. Okay, I had to put a message there so my phone doesn't interrupt. So what I was saying is an ultrasound will give us more information. So if they want to look at something specific to see if it's something not to be worried about, so cyst, fibroadenoma, dense breast tissue, trying to think of the other ones, sometimes calcifications, which can come from different things in your body that don't mean cancer necessarily. So it's important to go back. They may need to do other types of imaging, so not sure if you had a 3D mammogram like what I was talking about, or 2D mammogram, but they may want to do an ultrasound. Sometimes they do what's called spot views, and that's where they're going to push on the breast a little bit more. So if there's an area that they're concerned about, they can see it in a much greater magnification. So it just makes the area bigger, and the radiologist that's reading it, the breast radiologist, is able to tell more. So long explanation, it got messed up a little bit. I hope that helps, Lisa. Thanks so much for joining. We'll be praying for you that it's nothing to worry about, but shout out to you for getting your mammogram. So all my ladies, 40 and over, I need you to get your mammogram. Now, I know a lot of radiologists don't really like for all the women to get their mammograms in October. They want you to stay on the schedule that they recommend. But I say, if you get it in October and you get it every year and you're keeping up with it, then you're winning. okay? Don't tell them I said that, though. So I think it's good that you're getting it, okay? Yes, and Dawn says, praying for you, Lisa. Thank you so much, Dawn. Sorry, I got too much going on this phone. All right, so any other questions for anyone that's joining me live? Thank you so much. Let me know if you're getting value. If you are, if this is helping you and you know this could help other ladies, please share. Sharing is caring. Again, if you're just joining or watching the replay, I'm Dr. Melva, your board certified radiation oncologist. I help ladies who've been diagnosed with cancer, ladies and gents who've been diagnosed with cancer, learn more about their diagnosis, have a caring physician, and I actually have started doing second opinion consults through telemedicine. So if you send me a message on my Facebook, I'll send you the link to schedule. Caring, compassionate doctor, and I just saw that a lot of people weren't getting the attention they need. They didn't understand their diagnosis and they were frustrated. So I'm here to help with that. All right, Lisa says thank you. Thank you so much. Thank you everybody for joining. Again, it's Breast Cancer Awareness Month. It's October, broadcasting live. I'm Dr. Melva. Drop your comments below, please, and let me know, what do you want to know about breast cancer? I look forward to talking to you next week. We're definitely going to talk about more prevention, nutrition, exercise, the links between obesity, exercise that have been found in many studies for breast cancer, and then I'm open to answer other questions you have. So any other questions for me before I wrap it up? All right, let's see the comments. Thank you so much for joining. Just wait a few seconds. Sometimes I can't see the comments on this. So, all right, well, if there aren't any comments, please join me next week. If you like the broadcast, please share. Until next time, I'm Dr. Melva, and you can find me right here on Facebook.com/Dr. DOCTOR Melva, MELVA. Bye.